In this video, I want to talk about an exciting sort of emerging or innovative treatment for intervertebral disc degeneration. And this is something that affects millions of people, one of the leading causes of chronic neck and low back pain. And that treatment potentially for disc degeneration that we're going to talk about, exosome treatment. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. I want to start, as I always do, to point out this is not meant for specific medical advice. This is meant for general information and educational purposes only. Specifically, when we're talking about these regenerative orthopedic treatments, these are experimental treatments. And I want to make that very clear. I'm not promoting them. I'm not telling you should do them. I'm certainly not promoting my practice by any means. I'm just trying to put the information out there, hopefully in fairly easy to understand language, so that you can potentially understand more about it, maybe talk to your doctor about it, and make the decision that's best for you. It is not medical advice. Okay. If you've ever dealt with low back pain, and I've got low back pain fairly frequently, so I definitely get it, but low back pain, neck pain, stiffness, pain shooting down your legs, pain shooting down your arms, you can understand how debilitating that can really be. And intervertebral disc degeneration basically happens when the discs between the vertebral bodies lose hydration, basically dry out. They become less flexible, they shrink or compress, and that can be a number of different things. It can be injury for sure, it can be the natural aging process, it can be genetics. The traditional treatments, things like physical therapy, pain medication, injections like steroid injections, even surgery sometimes, can be helpful to a certain extent, but a lot of times they're managing the symptoms rather than helping to heal or regenerate the disc itself. And that's where, in theory, exosome injections come in. And it's a regenerative treatment option becoming very popular in the research part of orthopedic surgery, but starting to make its way into the clinical world. What exosomes are, and I try to explain this as easily as I can, but these are naturally occurring, what are called extracellular vesicles, naturally released by a cell, and in theory released by, or not in theory, but where it pertains here, released by mesenchymal stem cells, whether that's bone marrow mesenchymal stem cells or umbilical cord tissue, but they're released by one cell to basically act on another cell and cause something to happen, cell-to-cell communication. And they release bioactive molecules, proteins, lipids, and other types of material to try to cause the other cells to repair and regenerate. And one of the potential exciting parts of exosomes, unlike stem cell treatments, exosomes avoid some of the risks, the theoretical risks of stem cells like immune rejection or tumor formation, because there's no live cell actually being injected. It's just the extracellular vesicle from within a stem cell, then basically concentrated and injected into an area to try to promote regeneration, in this case around the discs. Now, let's talk about that. In terms of disc degeneration, where exosomes might be potentially administered, is administering it directly into or around the disc. Now, I will say I have heard of treatments for neck and back disc degeneration where they're given in IV fluid as an IV treatment and not directly into the area. But the theory, at least as it comes to disc degeneration, would be directly injected in that area. How they would potentially work? Well, they, in theory, reduce inflammation. They fight what we call oxidative stress, but most importantly, promoting the health of the disc cells, especially the nucleus pulposus cell, which is the inner gel-like core of the disc. Lab studies show that exosomes can help restore the extracellular matrix, the collagen, the aggrecan, essential for the structure and the function of the discs. Also, animal studies have looked at this, showing that exosome treatments not only have slowed disc degeneration, but potentially reversed disc degeneration by working on a number of different cellular and inflammatory pathways. They've looked at combining exosomes with these hydrogels to make them more sustained release and potentially almost provide a scaffold to provide long-term benefits and long-term structure of the disc. The potential is huge. There's no question. Potentially, if you can prevent further breakdown and degeneration of the disc, even regenerate it to how it was before, and hopefully avoid surgery, that's potentially a huge thing. I mean, when you're talking about whether it's just a microdiscectomy or a spinal fusion, that's potentially very, very exciting. Again, the human trials very early, still ongoing. So we have a long way to go. We'll need long-term data to show they're safe, long-term data to show that they're effective, especially comparing them to the traditional treatments out there. So again, this is still investigational, but those trials are starting to be done. We just need a lot more evidence about them. Really minimal side effects, minimal injection site side effects, maybe some soreness, but people rarely have any long-term issues with these. Again, it's not FDA approved, not just for disc degeneration, but really anything in orthopedics. So I put this information out there just to say, hey, it could be something worth talking to your doctor, certainly something to keep an eye on. I think they're going to be experimental for years and years and years for a variety of reasons. I feel that that's likely, but it is something to know about. It is something sort of the next frontier of non-surgical treatment, spine, and I've done videos on other orthopedic injuries, something potentially very exciting. Basically trying to not just harness the body's regenerative and healing power, but to improve it, to improve pain, improve function, but also hopefully restore tissue a little bit more to the way it was before it broke down. So if you're dealing with neck or back issues, it may be something worth talking to your spine surgeon, your orthopedic surgeon, and see if this is a treatment that can be right for you. Again, just understand this is not medical advice. I'm not promoting the treatment. I'm not promoting my practice. I just want you to understand a little bit more about it. All right, if you want a copy of an ebook I wrote called The Arthritis Solution, although it covers all different types of treatments for lots of different orthopedic problems, you can get that free. Just click the link for it in the description below this video. If you have an orthopedic injury and you want to hear about options other than surgery, other than cortisone shots, there's a link to a contact form on my website. Just click that link, fill out that contact form, and you can learn more about scheduling an appointment to see me. I'd also love to hear about your experience with your injury. Leave those in the comments below. Just understand, if you leave a question there, I can't answer that question and offer you medical advice, but sometimes I answer that question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thank you for watching. I look forward to helping you feel, look, and perform better than ever.